week left of being your governor. So I thought it would be kind of fun to revisit a place that goes back to the very early days of my work as governor. So coming back here was an appropriate place to, that's been a long time actually when you think about it. You all have been here about as long as I've been governor. And and I think back, Amir, when we were just getting our footing, if you will, with the IBN SINA. They were just beginning to build that first facility, and a very strong vision, a very clear vision of where this facility was to go. And it's a genuine pleasure for me to see the results of that type of work, of men and women of rather diverse backgrounds coming together with a single focus to do good, to deliver health care to those who otherwise might not have access to it. And from my perspective, what's as impressive as anything is that you continue to invest so much of your time and your energy, your resources to the people of Houston. And you know, instead of just resting on your laurels, you've been working harder every day to reach more people, to make an impact on people's lives, to make them and their families stronger, healthier, even more than simply doing good for the community. You're also inspiring others by your witness of what happens when good people set about helping others. Centers like this and others across the area stand as example of things how they should work. I mean, you're an example to not just the healthcare side of things, but you saw a problem and you addressed it. You came together, and I like to say the Texas way, and figured out how to make it work. In this instance, people without much money were either going to the emergency rooms, as Neil was sharing with you, for routine care, or simply going without. The first clinic opened in 2001, gave them a place to go, and it also gave them hope. A place where they could receive the care they needed at a cost that they could afford. Staffed by some of the finest doctors in Houston, some of them in this room, donating their time, their extraordinary experience, utilizing the latest technology to cut costs when possible. You not only got the doors open, you kept them that way. That's better for Houston. It's better for our state. It provides a measure of relief for emergency rooms that previously had to either provide non-emergency care or deal with a critical case resulting from a routine condition left untreated for too long. It was a true grassroots solution to a societal problem. And in my experience, those are the ones that work best. 14 years later, not only are you succeeding, you're thriving. There are hundreds of thousands of area patients who have gotten the treatment they need to recover from an illness, from an injury, or for that matter, even a toothache. At one of these 5 community clinics. Today, that number goes to 6. The important thing to remember is that this clinic is more than just brick and mortars. It's more even than the people who have worked so hard to make all of this possible. It represents better lives for patients, for those who come here. It gives them healthier lives. It gives them a better future. As I said earlier, it gives them hope that the best years are in front of them. More quality time with their friends, with their families. Every life you touch has concentric circles of influence going out, and it opens up opportunities that previously weren't there. I commend everyone who gave so much of themselves of this effort, and congratulate all of you for what you've done and what you will do in the future. God bless you, and through you, may God continue to bless the great state of Texas. Thank you.
गवर्नर ने मुख्तलिफ शोबों में बेहतरीन कारकर्दगी दिखाने वालों में अवार्ड्स तकसीम किए। इस इदारे के क़याम का बुनियादी मकसद जहां ऐसे लो इनकम अफराद तक हेल्थ केयर फैसिलिटीज़ पहुंचाना है जो महंगी मेडिकल सहूलियात को अफोर्ड नहीं कर सकते, वहां तेज़ी से बढ़ती हुई अनडिज़र्व्ड पॉपुलेशन की हेल्थ केयर नीड्स और मेडिकल के शोबे में काम करने वाले इदारों की इस्तेदाद के दरमियान गैप को भी कम करना है।
My name is Nasruddin Rupani. I am the chairman of the IBN SINA Foundation Board. I'm very honored and privileged to serve this board, and I thank you for the board for letting me serve as a chairman. For the last 14 years, with the grace of Allah, we've been serving over 500,000 patients already, and moving forward, we will be serving 100,000 patients every year. We will be saving millions and millions of dollars to the city and county by serving and providing the primary health care, because primary health care is the one that we can stop the suffering of a lot of indigent patients who cannot afford to see a doctor. This is and all the, like I have mentioned, 41% of the emergency room can be minimized by providing primary care. If you provide this kind of facilities in all the neighborhoods and make it accessible, that is the key. Accessing these walk-in clinics, people can come in at their own time, they can come early morning and get service without any appointment. They just walk in, and walk-in clinics are now important because everybody has a lot of challenges and time and their jobs. So this walk-in clinic has a model that has been very, very successful. We've been serving this for almost 14 years. We'll continue to serve. And as we have just recently announced that we will be opening 2 more clinics. And by 2016, we'll have 8 more clinics. And inshallah, God willing, if things all work out the way we are growing, we will inshallah, by 2020, we will have 10 clinics and a hospital to support this 10 clinic.
I, on the behalf of the Board of Directors of IBN SINA Foundation, would like to express my profound gratitude and thanks to Honorable Rick Perry, Governor of the State of Texas, Honorable Mayor Pro Tem Ed Gonzalez, Council Member Jack Christie, Council Member City of Sugar Land, Himesh Gandhi, Amy Mitchell, Mr. Afzal Mahmood, Pakistan Consulate General, the Honorable Marty McKevey, United States Agency for International Development, Mr. M.J. Khan, Mr. Gordon Kwan, Mr. Jay Guerrero from the Office of Senator Cornyn, for their presence in this historic occasion. Your presence this morning is the great source of inspiration to our donors and volunteers. I would like also to thank Mr. Neil Ratcliffe, Gabe Uncle Saria, and other staff members of the City of Houston's Housing and Community Development Department for their continuous support. Thank you, Commissioner Michael Shan Senegal from Jefferson County, Council Member from City of Port Arthur, and other distinguished guests for your presence this morning. Thanks to Aga Khan Council for Southwest, especially Mr. Aftab Gisani, for his constant support, guidance, and his personal interest in the indigent health care. I would like to thank Harris County Healthcare Alliance, Gateway to Care, Houston Endowment, Cullen Trust for Healthcare, Episcopal Health Foundation, Simmons Foundation, Lone Star Association of Charitable Clinic, and many more for their continuous support. Special thanks to our collaborators, Rose Clinic, Houston Police Department, Sergeant P. Carr, TRZ Builders for their support to the foundation. Special thanks to the safety and security volunteers from the Aga Khan Council. We thank our donors, our staff, our dentists to our present clinics all over the Houston, Port Arthur, and Clear Lake, and also to the entire staff who have been working very hard to bring this institution to a next level. Also, our sincere thanks to the Jewish community volunteer physicians who have been playing a vital role in providing the services to the indigent care. My sincere thanks to the physicians of the Doctors Hospital Tidwell and the other volunteer hospital of the Wilcrest Clinic. Our sincere thanks goes to all the media partners, radio, television, newspaper, especially to Ralph and Cynthia Nickerson, Zenat Mita, Barbara Megana Robertson, and many other for their continuous support. Thanks to Shermin Chow for being with us for last several years. Local churches, local school principals, Seven Diners, and all the neighboring businesses who have given us the parking this morning. Very special thanks goes to our entire advisory board led by Dr. Berkat Charania, and especially Cheryl Dasho for your continuous legal support, and Marcela Marini for our help with the Hispanic community. Directors and local community volunteers for the Wilcrest Pediatric, Clear Lake, South Posto, Port Arthur clinics, because without their voluntary support, we will not be able to achieve this target. I would like to thank our team, event team, who has been working day and night to make this event possible. Iqbal Manji, Minas Velani, Afshi Charania, Zora Kamdar, Liaquat Khwaja, and none other but my better half, Shanaz Ajani. I would like to thank Jack Christie, Judge Griffith, Tom Abraham, Virani family for their donation of the pediatric building, Rupani family for the donation of the dental clinic, Mr. Bahadur Sohani, who has been our supporter from day one, H.R. Sheikh, and Mr. Brownberry for their legal support. I want to thank Mr. Rafiq Duka for providing us lunch today. Please make note that lunch will be served at the end of this ceremony. The list goes on and on and on, and I'm sorry if I missed anybody. Last but not the least, I want to thank our First Lady, Ms. Anita Perry, when she came in for the first time in 2002 and gave us the vision of immunizing Texas children. And it was her passion that drove us to this level. We are the proud provider of immunization on behalf of state of Texas. I'm also thankful to our Hispanic partners, Telemundo, Fox, and all the crew members who are present here. Together, we all will make a significant impact in the lives of community. Thank you very much. God bless you and God bless America.